Welcome everyone. I'm Sinem Gültekin and I will be your instructor for the Necropsy and Diagnostic Pathology course this term. Necropsy is the process of opening a cadaver according to a defined protocol to investigate the cause of death and disease by examining its organs and tissues. While the term autopsy, which literally means having a look at with someone's own eyes, is often used interchangeably, we prefer necropsy in veterinary medicine, which translates to having a look at something dead. As we begin this journey, remember the phrase "Morti vivos docent," the dead teach the living. Our goal is to beyond simple dissection and learn to read the messages left by the deceased to identify the etiology or cause and the pathogenesis or progression of diseases. I will say to you later, but let's remember our roadmap for the next 14 weeks is designed to provide you with a systematic understanding of post-mortem examination. We will start with the fundamentals, focusing on biosecurity, laboratory safety, and the essential equipment needed to perform a professional examination. Understanding the nature of death is crucial, so we will study postmortem changes such as algor mortis, body cooling, rigor mortis, and autolysis, etc. Distinguishing these changes from actual lesions, which are structural abnormalities in tissues, is a vital skill you will develop. From there, we will proceed through the organ systems, including the musculoskeletal, cardiovascular, respiratory, digestive, and nervous systems. You will learn to evaluate organs based on their size, weight, color, and consistency to detect abnormalities like pneumothorax or intestinal intussusception. As I mentioned in our class announcement, the practical aspect of this course is highly dynamic. If a case arrives at our veterinary department, we will have the opportunity for a field trip to perform a real-time necropsy. Remember from the announcement, during weeks without fresh material, we will engage in case analysis sometimes, using visual aids to identify pathognomonic lesions, which are changes so specific they provide a definitive diagnosis on their own. Lastly, please keep in mind in your first assignment, which is due in 2 weeks, ensure you submit it as a PDF to my email sinem.gultekin@neu.edu.tr. This course is the essential link between the basic sciences you have learned and the clinical medicine you'll practice, forming the foundation for understanding disease throughout your career. Let's begin our first session. Necropsy is far more than a postmortem procedure. It is critical scientific inquiry that bridges the gap between clinical observation and the fundamental nature of disease. By mastering this discipline, we don't just find the cause of death, but we actively contribute to higher diagnostic accuracy and more robust disease surveillance within animal populations. A successful diagnosis rests on the critical trait of the animal, its environment, and its history. We must recognize that our future as veterinary professionals depends on this rigorous framework, as any negligence in these areas inevitably leads to diagnostic failure and clinical errors. We'll say this, but firstly, let's look our course description, course content and objectives. In our necropsy course, we'll see how to macroscopically evaluate and diagnose veterinary diseases is demonstrated using medical and scientific necropsy methods to assist in the diagnosis of diseases. Necropsy course aims to evaluate and diagnosis of veterinary diseases macroscopically and to help diagnose the disease by using medical and scientific necropsy methods. The necropsy course demonstrates how to macroscopically evaluate and diagnose veterinary disease using medical and scientific necropsy methods to aid in disease diagnosis. It covers theoretical and practical information such as necropsy techniques, death certificates, procedures, and reports preparation. Let's look our roadmap. We are going to talk about history, general principles, aim of necropsy, general rules in necropsy, importance of necropsy, time of necropsy, location of necropsy, precautions, disposal the carcass, basic equipments, euthanasia, definition and types of death, postmortem changes are very important. Postmortem findings encountered in some organs, necropsy methods, general methods, dissection stage, display stage, examination stage, according to systems and in different animals, examination stage, collection and submission of specimens for laboratory examination, and the necropsy reports. Upon completion of this course, you will learn information about the death certificates, learn the necropsy environments, learn the necropsy methods, learn the preliminary diagnosis, learn how to perform a necropsy, most importantly, learn how to detect lesions and examine organs during necropsy and taking samples, learn the rules for sending materials to the laboratory of veterinary pathology, learn the writing necropsy, learn how to write a necropsy report. So I want to continue with this quote. Internists know everything and do nothing. Surgeons know nothing and do everything. Pathologists know everything and do everything, but it is too late. So about necropsy, we have lots of questions, and I want to ask some questions to this phrase, to these words. For example, why, what is it, when, and how, and with which materials, who, with who we perform the necropsy. What is a necropsy? When do we perform a necropsy? Why do we need to perform a necropsy? How do we do a necropsy? How do we perform a necropsy? And with which materials we need to do necropsy? And who should do the necropsy, or with who you should do a necropsy? So let's look and try to find answers to our questions. Let's start with what is a necropsy. A necropsy, also called a postmortem exam, is an examination of an animal after death. It is performed to obtain an accurate cause of death, and when done properly involves looking at the animals as a whole as well as looking at each individual organ within the body. Careful examination and sampling of organs helps determine the cause of death, whether it is by disease or trauma. What is a necropsy? Let's continue. Necropsy is a postmortem examination, as we said before. Traditionally, the term is often used to refer to the postmortem examination of a non-human animal, while the term autopsy is used for the postmortem examination of a human. However, the terms are essentially interchangeable, and some veterinary pathologists have advocated for the use of a common term to improve communication in the age of one medicine. Both terms are derived from Greek words. Autopsy comes from the word autopsia, meaning to see with one's own eyes. Necropsy comes from the word necros, meaning death, and the suffix opsis, meaning to see. The term necropsy can be used broadly to encompass all diagnostic procedures performed after an animal dies. However, we will generally use it to refer to for the to the microscopic or rough examination of the carcass and the process of collecting tissue for pathology and other ancillary testing. The role and importance of necropsy in veterinary medicine. Veterinarians who perform necropsies improve clinical diagnosis and treatment success by better analyzing disease processes, documenting disease incidents in animal populations, and monitoring zoonotic diseases are possible thanks to necropsy. Data obtained from necropsies directly support health monitoring programs for herds, barns, or poultry. As a scientific examination, necropsy is the process of identifying pathological processes linked to clinical examination and understanding the nature of the disease. Components of clinical examination and its role in diagnosis. Clinical examination consists of three fundamental complementary dimensions: the animal, anamnesis or history, and environment. The future of veterinary medicine depends on the ability to provide services based on accurate diagnosis and the meticulous application of clinical examination. Anamnesis is the most critical link in the clinical examination, and its accuracy is directly proportional to the veterinarian's medical knowledge. The veterinarian's in-depth medical knowledge enables them to ask the right questions to the owner and interpret the answers meaningfully. Important considerations when taking a medical history or anamnesis. Data obtained from the medical history should be continuously compared and verified with observations made during the physical examination. Particular care should be taken to avoid concealing inconsistencies and omissions in the timeline, especially in animals with food value. In herd health management, every case of illness should be considered as a herd problem until evidence to the contrary is found. Recording the medical history in writing allows the owner to focus and organizes the clues that the veterinarian should follow. Integration between anamnesis and necropsy. In a necropsy performed without anamnesis, tissue changes can often be overlooked and organs may appear normal. A necropsy combined with differential diagnosis allows the physician to search for specific lesions and uncover hidden pathological findings. An accurate anamnesis and a mentally prepared list of differential diagnoses are essential for reaching a definitive diagnosis. The interpretation of pathological findings only makes sense when it is integrated with clinical data and the animal's history. So it's very important for us. Standardized necropsy protocol and technical discipline. Necropsy is a scientific discipline requiring a systematic approach as well as general and specialized pathology knowledge. A standardized necropsy procedure facilitates accurate diagnosis by ensuring precision, order, and completeness. Familiarity with the normal color, size, and consistency of organs is critical for distinguishing early-stage tissue changes and pathologies. Early changes can be detected in organs that appear macroscopically normal through cytological smears and histopathological examinations. So let's look wise purposes of necropsy and professional ethics. To determine the nature of disease, anamnesis, clinical signs, and laboratory tests should be supported by necropsy findings. Necropsies play a vital role in understanding pathogenesis and developing rational treatment or control measures. A successfully performed necropsy reinforces the trust and satisfaction of the animal owner, especially breeders in the veterinarian. Surveillance studies and statistical data collection processes enable the early detection of economic losses and subclinical problems in businesses. Why does a necropsy? Necropsies are performed to determine or confirm the cause of death or reason for a condition necessitating euthanasia. A necropsy may be requested by an owner, a veterinarian, a drug or vaccine company, a biomedical researcher, or a law enforcement or other government agency. Why should we perform a necropsy? Sometimes you may know why an animal has died. For example, there might be evidence for severe trauma. In other cases, the clinical signs of a disease may indicate what happened to the animal. Most times, however, the nature and extent of the disease process may be unknown, or the symptoms could have been caused by one of several different diseases. In these cases, it may be of great benefit to examine the animal more closely. Let's talk about them. Why? From the perspective of pet owners and the other people. Reasons necropsies are requested from an owner, a veterinarian, a drug or vaccine company, biomedical researcher, or a law enforcement or government agency. Let's see a point of view of an owner. Owner wants to gain peace of mind, especially about a decision to euthanize. Maybe a rule in or out infections, toxic cows when other animals are at risk. Suspicion or malicious action by another party, usually the neighbor, and suspicion of veterinary malpractice, some concerns about zoonotic diseases like rabies, insurance reasons, most commonly in horses. From a veterinarian's perspective, a veterinarian wants to find answers in a confusing or atypical case. Also wants to confirm a suspected diagnosis, or wants to examine surgical sites or retrieve implanted devices, or maybe collect data about a condition of interest. A drug or vaccine company, biomedical researcher, determine if drug or vaccine caused illness or death. To investigate cause of unexpected death in an animal on a study, or compare control and experimental animals at the end of study. Law enforcement or government agency may want animal harmed or killed during may wants to investigate if an animal harmed or if the animal harmed or killed during police activity, or suspicion if there is a suspicion of criminal cruelty or neglect, or a suspicion of a pet food related toxicity. So let's continue with the whys. Reasons to perform a necropsy in an animal. Let's summarize. Identification of disease, indicate appropriate treatment of disease in a herd, limit future losses, improve understanding of disease effects on your animals, enhance discussion of health maintenance programs with animal health specialists. What information can and cannot be gained from a necropsy? A necropsy can result in a definitive diagnosis, a presumptive diagnosis, or if there are no gross lesions, will at least rule out some possible diagnosis. Autopsies are quite satisfactory, especially when they reveal pathognomonic macroscopic lesions. These macroscopic changes are specific to a particular type of disease and usually allow the autopsy specialist to make a definitive diagnosis without the need for additional tests, but sometimes. In some cases, the autopsy reveals no lesions suggestive of the cause of death. This is either because all organs are macroscopically normal or because the body is so decomposed that lesions are indistinguishable from decay processes. Miscarriages and neonatal deaths are among our least productive autopsies, and these cases often remain unresolved even with complete ancillary testing. Causes of death that generally reveal minimal or no apparent lesions include metabolic disorders, many toxicities, especially neurotoxins, and cardiac arrhythmias. In the vast majority of cases, the autopsy provides some clues about the disease processes, allows for a presumptive diagnosis, and in many cases, allows for sampling for additional tests that will provide a definitive diagnosis. So let's talk about when to refer a necropsy. Some types of autopsies are best handled by specialists in facilities specifically designed for autopsy examinations. I will repeat the sentence. Some types of autopsies are best handled by specialists in facilities specifically designed for autopsy or necropsy examinations. Autopsies or necropsies should be referred to a diagnostic laboratory with certified pathologists in the following cases. First, when a client raises concerns about a patient's veterinary care, or cases that are part of a legal dispute, forensic autopsy, or cases where a zoonotic agent such as rabies or tularemia is suspected, or cases involving unknown species such as non-human primates, reptiles, and birds, etc. Opening body cavities leads to a significant artificial change in the color and consistency of internal organs and can impede both the rough interpretation of lesions and the ability to collect the most suitable samples for further testing. The preferred method at this stage is to proceed with the autopsy, take digital photographs, and send this photograph to us, to pathologists, veterinary pathologists, along with formalin fixed and if appropriate samples. If appropriate means if it is possible to send the samples, for example, in an hour or in maximum 2-3 hours, because otherwise the sample will start to decompose. So if it is possible, if it's not possible, you should send us, or they should send us the samples with formalin fixed cups, 10% formalin. Ideally, the animal should be brought for necropsy, or it should be brought to a pathologist immediately after that for a necropsy to be performed. This is the more accurate, more true, more fine way to perform a necropsy. Let's talk about some other house. In the field of observation, change only aids prepared minds. Louis Pasteur. When necropsy is made a routine practice, the physician's observational skills and capacity to detect pathological changes are maximized. But we will have many questions. We will have plenty of time, an academic semester, for other how-to questions regarding necropsy. For example, how is a necropsy performed? How is necropsy performed on different animals? How is an animal carcass opened during necropsy? How are organs examined? What are the equipment do we use during a necropsy? Not equipments. How do we use this equipment, and how should we, for example, hold a knife? How should we hold the knife? This is very important actually. Where is the necropsy performed? Where is? And what safety precautions are there we should take? What should be sampled? Which organs? Which lesions? How is a sample taken? How is the sample processed? What laboratory stages does it go through? How are macroscopic and microscopic diagnoses made? Etc. Therefore, I think we can end this first lesson here. Let's talk about, let me show you the references I used. Other references and useful resources and suggestions for all pathology lessons include also necropsy lessons. Okay, thank you for your attention and have a good day.